I'm Jennifer May. I'm the dietitian for the Cancer Patient Support Program at Fletcher Allen Healthcare. I've been there for 7 years. Prior to that, I got my undergrad at University of Vermont and did my dietetic internship at Brigham and Women's and Dana-Farber in Boston. So our title is, and unfortunately too, I don't know if Curtis is going to come in. He did a beautiful job with on his Mac, and so it looks very different on the system. So I don't know if he'll come in with his laptop or not. But our topic is Recipe for Breast Health: Understanding How Diet and Weight Affect Prevention, Survivorship, and Caregiving. I have no disclosures. I don't think Curtis does either, but I'll let him tell you that if so. And jumping right in with some facts and figures, here's what we know. So we know that breast cancer is the most common cancer diagnosed in Vermont women. Each year, approximately 494 breast cancer cases are diagnosed in Vermont women. And that accounts for about 29% of all cancers that are diagnosed in that population. We know, too, that there are some things that we can't control. So we know that even women who live healthy lifestyles, they still get breast cancer. We can't change risk factors like our family history, which is predicted to contribute to just over a quarter of breast cancer risk. However, we also know that according to the American Institute for Cancer Research, there's evidence that lifestyle-related factors may account for about 30% of all cancers in Western countries. So looking at these statistics, it's really no surprise that controllable lifestyle choices are receiving a lot of attention in helping to tip the odds in our favor to reduce the risk of diagnosis and reoccurrence of breast cancer. For this session, we're going to look specifically at diet and weight management as those controllable factors. I'm stalling here, wait. So what we must keep in mind. We must keep in mind that it's unlikely a single food. That's okay. No, you're good. We started a little bit early. They made me. So Curtis, I decided to jump on in because I think the times got a little bit switched. So we said, you know what, let's get them in, out of here. They all want ice cream. That's okay. Take your time. So what we must keep in mind. So like I said too, it's unlikely that a single food or diet alone can prevent you from getting breast cancer. There are just better choices than others to keep your body the healthiest it can be, boost your immune system, and help keep your risk as low as possible. In the same respect, it's important to remember that no food or diet can cure cancer. Though some of them may help control treatment-related side effects, they allow your body to get well after treatment and decrease your risk of reoccurrence. And then not only does no single food or diet prevent or cure breast cancer, but also remember that no single study provides the last word on any subject. So there can be a lot of conflicting information out there, as you probably know. However, so what has been found from multiple studies is that there are 3 controllable lifestyle choices that we can say with some confidence that decrease risk factors for diagnosis or reoccurrence of breast cancer. And those 3 controllable factors, so maintenance and or achievement of a healthy body weight, exercise, and limiting alcohol consumption. Once again, our focus will be on the healthy eating and weight management, but all 3 components really go hand in hand, and we'll have time for questions at the end too. We can touch on any of these components. So the maintenance of a healthy body weight, it's one area of breast cancer prevention. It's clear and consistent, and I think it's been a message that's been said at multiple sessions. More and more evidence suggests that being overweight, it raises the risk for diagnosis and reoccurrence, and then it reduces the odds of survival for many cancers, including breast cancer. So for a local perspective, it's been noted that about 70% of breast cancer patients treated at Fletcher Allen Healthcare are overweight or obese, which is why this topic is so important to address. And most of the research that links one weight to breast cancer, it focuses on the body mass index, or the BMI, as one tool to determine one's risk. So BMI, it's an estimate of body fat composition based on your height and your weight. And why we focus on body fat is because body fat is not dead weight, it's active tissue that's producing estrogen, which we know is a risk factor, and proteins that can lead to inflammation, which is another risk factor for cancer. It's important to remember, though, too, so BMI is just one tool. It's not necessarily accurate for the elderly who have less muscle mass or bodybuilders with more. And in both, so adult men and women, the World Health Organization, it divides BMI into various categories that you've probably seen. You can find your own BMI. You take your weight in pounds, multiply by 703, and then you divide by your height in inches squared. Or you can refer to, there's lots of BMI charts, such as this one, and then there's also several automatic BMI calculators available on the internet that you just plug in your height and weight. So what the research has to say about BMI is that women with a higher BMI have a higher probability of developing breast cancer compared to women with a normal BMI, but especially after menopause. So the increased risk of postmenopausal breast cancer is thought to be due to the increased levels of estrogen in obese women. So after menopause, when the ovaries stop producing hormones, fat tissue becomes the most important source of estrogen. So because obese women have more fat tissue, their estrogen levels are higher, potentially leading to more rapid growth of these estrogen-responsive breast tumors. It's also important to point out, though, so weight gain among previously trim women also can do harm. So gaining even just 20 pounds of weight as an adult, so being between ages 18 to about 50, increases one's risk after menopause. So there was a result from a study. It was over 80,000 nurses, and they found that women who gained 55 pounds or more after the age of 18 had almost a 50% greater risk of breast cancer. 22 pounds was associated with about an 18% risk. I also have all these studies, too, if anybody's interested. Fortunately, though, the research also shows, so for women who are overweight, a moderate weight loss, so just 5 to 10% of your current weight can reduce your risk. So that's the good news. It's this modest weight loss, 5 to 10%. So it makes it a little bit more realistic and achievable. In perspective of women who are undergoing treatment, breast cancer is one cancer where we actually see weight gain with treatment, and specifically with chemotherapy. We don't necessarily see it with women who just get radiation, or women who just have surgery, or women who just have surgery and radiation. Why we see the gain? Potentially premature menopause brought on by chemotherapy. So there's a slowdown in metabolism, stress, changes in body composition, something called sarcopenia. So the body gains more body fat and it loses lean muscle. Use of steroids during treatment, food cravings and changes in food choices, decreased exercise. So those are just some of the reasons. So it's really important to encourage healthy eating and exercise during treatment. So important to be aware of this and then be proactive too. Doesn't matter how you achieve that healthy body weight, but obviously there are some ways that are better than others, especially during treatment. And I believe Curtis may touch on, he has a great resource, Cooking Through Chemo, too, that can be helpful. Weight loss, it really comes down to a simple equation of burning more calories through physical activity than you take in from food and beverage. So a simple equation, but it's not always that simple. So these are some just common weight management strategies, all of which can be effective, but really the key is finding a practical approach for weight management. So really looking at making lifestyle changes and not just going with the latest fad diet, because there's a lot of them out there. It's also to meeting the person where they're at in their journey with weight management. A good first place you can start, where sometimes I'll start with patients, is just determining determining how many calories that they need to maintain or achieve a healthy body weight. Journaling can also be a really effective tool. It helps with awareness. It also helps to keep you accountable to yourself or to somebody else as well. In counseling, so when I do counseling too, I focus on realistic lifestyle changes, and what I like to do is look at food, fluid, and fitness, so the 3 F's. For the food component, one focus is looking to implement more of a plant-based diet. Another way to look at it too, Mediterranean diet is also another term. The New American Plate is another term that gets used to discuss this plant-based diet. Curtis and I were talking about the low glycemic index or the glycemic load too, which I'm happy to talk about, but they're all similar ways to look at this using more plant-based foods in your diet. And really what approach I take with somebody is what they feel most comfortable with and what they're most aware of. And this idea of focusing more on a plant-based diet, so fruits, vegetables, whole grains, nuts, beans, seeds, and legumes, it's encouraged by the American Cancer Society, the American Institute for Cancer Research, many, many others, because these food sources, they're great sources of vitamins, minerals, antioxidants, phytonutrients, which can all help keep our bodies healthy and boost our immune systems. Lots of research behind these plant-based foods that are coming out and their benefits. Not to mention, specifically for weight management, they're packed with water and fiber content so they can help keep us feeling full at a really low calorie cost, especially of fruits and vegetables. And then bottom line, so when looking at food, fluid, and fitness, what I like to do is just set 1 to 2 really specific, achievable goals in each of those categories. And then we focus putting your efforts into those practices so that they become habit, and then you move on. Because usually it's not about knowing what to do. People realize what are healthy and less healthy choices. It's how we think about food and exercise. It's really about cognitive restructuring. So how do we turn that knowledge into positive behavior? It takes practice, it takes patience with yourself, and then it takes a lot of support too, which is really important. So there's some questions that still remain about the best diet for prevention and for survivors. However, there are some key basics that seem to have held strong during the years, so including choosing whole foods, so those in their more natural state, and I think Curtis is going to touch on that too. Focusing on a plant-based diet, as we discussed, and then remembering to everything in moderation. And unfortunately, we do know, so there are things like genetics, the environment, that we don't have control over. However, we also know that we do have control over our lifestyle choices that we choose to make. And we know that healthy choices can help protect us against serious illness, like heart disease, stroke, and adult onset diabetes. And now we can also potentially decrease our risk of development or reoccurrence of cancer. So these changes really can only enhance your health, and most importantly, can add pleasure to your life too. So I'll conclude with that. I'm going to pass it along to Curtis as he'll get into more of the fun food piece here too. And I apologize, you didn't miss too much.
I'm so sorry I'm late. I had a cooking demo, and then the part of cooking demos is you have to clean up because there's someone right after you, so I apologize for that.
Thank you for doing all you're doing.
Oh, thank you. I do it selfishly, but at the same point, I have a big heart, and I want to share what I know. And, I know a lot about food because, obviously, if you just take a look, right, you don't get this way overnight, right? So I didn't get to my disclosures, but I'm Curtis Hemm. A lot of people, know me as Chef Curtis from WCAX. I've done a lot of spots on there. I used to be the dean at New England Culinary Institute. So, and then before that, I was a program coordinator at Paul Smith College in their culinary arts curriculum. So I spent a lot of my professional career as a chef in restaurants. I spent a lot of time overseas in France. And then I consider myself a master technician in the kitchen. That's what I pride myself on, is technique. 8 years ago, January of 2005, my wife rolled over and felt a lump in her breast, and it changed our life forever. And I won't ever forget that moment, and I won't ever forget the last 8 years and the alterations that had. So for me, I stand here in my disclosure. I'm also affected by skin cancer, but primarily I'm a caregiver to my wife. who's an 8-year survivor, and I have a company that's dedicated to doing two things. One, providing very real, relevant content about cooking and erasing the deficit of cooking skills in our population, especially healthy cooking skills. Second, I'm designed my company to raise money for organizations like Vermont Cancer Center, American Cancer Society, Komen, all those things. We donate 33% of our top line revenues back to organizations that fight cancer. So those are my disclosures on that. Back to this, which I consider to be a very weighty matter. For me, I've spent a career in the psychology of food and the behavior of how people relate to food. And so understanding why we eat what we eat, I think, is a very critical element to any moderation in your diet. So I'm obviously, right, part of disclosures, I'm a large guy, okay? I'm smaller than I was a year ago by 80 pounds. I will be 80 pounds smaller next year. Those are my goals. I did those goals through journaling, through calories in, calories out. I sat in this very room, that very back chair, watching Dr. Jean Harvey-Barino talk to breast cancer patients about calories in, calories out. And she goes, I'm sorry, that's just the fact of the matter. It's calories in, calories out. If you want to lose weight, it's calories in, calories out. So I took what my base metabolism needs were, calculated it for my size, decided where I wanted to be as an end weight, and I started journaling, and I started playing this little game with myself about how much delicious food could I have for those calories, right? Because I'm not going to lie, I like to eat. That was part of my disclosures. I really like to eat. I like to cook. I like to have fun in the kitchen. I enjoy food. I have a great relationship with food. I have a healthy relationship with food now. And I think that's a really important thing. And I think that's the piece that I'm passionate about. So when I called the Cancer Center and I said, look, I really would like to make a difference and not just do culinary demos. I want to share what I know. I want to have an impact. That impact is you can live with cancer, you can get on a continuum of improvement, and you can love food, and you can have a healthy relationship with food, and you can understand why you eat and why you enjoy it and build on that. And I think that's it's a really great thing about life, about being a human being, is you can enjoy food in the company of others while you share a meal. It's a very enjoyable part of being human. Otherwise, we're all just grazing out in the field. So, why we eat is a real fundamental question, and I think we have to look at it. In my own journey with weight loss, I looked at why I eat. I was an emotional eater, you know? I'm around foie gras, I'm around shrimp, I'm around filet all the time. It's not what I ate. You know what I ate? Cornflakes, rice checks, every night. Every night before I went to bed. I had a couple cups of cereal with a couple cups of milk, and guess what? Boom. That's life. You know, that's what happens. That's a very comforting thing for me. I understood my psychology. At the same point, the same conversation with Jean Harvey-Barino, I understood that for me to make a shift in my diet, there had to be a modification in my behavior. So I took my psychology of how people eat, how I ate, and my understanding, and I changed it. And I decided, what do I really like to eat? Well, I really like steak, right? So what's the best steak you can have? Grass-fed, grass-finished beef. I focus my budget and my stuff, and I eat that. I eat grass-fed pork. I eat really delicious food all the time now. I eat more of it than I ever have, and it just comes off, and I'm really liking that. You know, it's a great thing. So understanding, I think, why you eat, and I have to look at this because I'm a Mac guy, so this is like more intimidating than standing up here. There we go. Why do we eat? So we eat for, obviously, fuel. We need calories. We need to, you know, expedite our I'm just going to set that here if you don't mind. We need to power our bodies. So when we think about food as fuel, that changes our paradigm and our look at food. Because from just a functional existence, we eat so we can move and so we can live and breathe, period. Now, there's also an element of being human, right? Because I have a dog too, and I watch what my dog eats, and it's kind of funny, right? We eat because it comforts us. We have a relationship with food, just like we have a relationship with people. And I think we really need to understand that relationship. So I stand here as a big guy, and I had an unhealthy relationship with food. I've shifted that, right? We eat because our culture and our community says we have to eat. We have to share a table. It's communal, right? That's a good part about eating and dining and whatnot. We eat out of habit. How many people just mindlessly eat? Come on, be honest, right? Come on, we all do it, right? Popcorn, you ever go to a movie? Right? How much popcorn could you possibly eat, right? But it goes away, right? At the end of the movie, that popcorn's gone, right? And we eat because of emotions. Cereal for me was an emotional crutch. It was like a drug. Every night, that was what comforted me. That was grounded me. It wasn't a beer. It wasn't wine. It was cereal, right? I would have been better off, I think, with a beer. But hindsight being that. If we look at, though, what we eat, right? We understand why. Now we look at the substance of what we eat. It's scary. So we did a sodium reduction. We wrote a grant proposal for the Vermont Health Department. And I learned a lot in that process about processed foods and about where sodium is. And sodium, for me, is the number one nutrient piece in the nutritional analysis that we do in our recipes. I have the hardest time controlling that. It is incredibly difficult to control sodium, and I have praise for anyone on a low sodium diet, because that's just a beast. That's a hard one. You can get rid of fat easy. You can get rid of carbs easy. Sodium, tough. So 77% of the sodium we take in is in the form of processed foods. So only 8% of the sodium that we take in is from adding salt to food, right? Unless you happen to be a chef and you do one of those like really big power doses, right? Now, with that excess sodium, right? Because if anybody just took a tablespoon of salt and just took it, what would be your reaction? It'd be awful, right? But when you mix salt and sugar, yeah, it's not so bad. Think of bacon, salt and sugar. It's a wonderful thing. So we hide sodium in our food from sugar. So now we have all these calories in existence, and that's a problem. So we have a lot of empty calories. We have sodium, which causes inflammation, which we know is a bad thing, right? So we have these empty calories. Now that food lacks many nutrients that we need. So we've got this processed diet that comes in a box, right? I don't know if you've ever seen a farmer that has boxes growing, right? Think about it. Wouldn't that be funny, right? And then we have to think about our body's response to that. And now we have to think about how we got here, right? So I was in Starbucks the other day. Not to bash Starbucks. I love Starbucks, right? I was looking around. I was looking at all these kids, and they're drinking their lattes and all this stuff. And I drink black coffee or espresso. And I was wondering how many people knew how to make coffee. Coffee or tea. Right? And I've used this in each one of my culinary demos today. How many people actually know how to make a really good cup of coffee? A lot of kids that are growing up now think coffee comes from Dunkin' Donuts or Starbucks, right? If you think about the empty calories in a coffee, the damage that coffee can do to you over time, not only fiscally, because, right, a coffee is now like $5, right? And these kids are drinking 2 or 3 of these a day. But you think about it nutritionally, and it's an awful thing. Think about if you had to have that person cook Thai food like we just did. Would they know what to do? It's very difficult to imagine that these kids know how to do this, right? So as the dean of NECI, I could see all these kids coming in, wanted to be chefs. They loved it. It was a glam job, right? And I'm sitting here thinking, I know the reality of that job. It's not a glam job at all. But they don't know how to cook. They never cooked, right? And if they did, they took beef tenderloin and they sauteed it. And beef tenderloin, I don't care what you do to it, it's going to taste good, right? Unless you're a vegetarian, then it probably tastes horrible. But beef tenderloin in itself, you can't mess that up, right? That's an easy foie gras, easy flavor. It's fat, it's delicious. It wins all the time, no matter what you do. So now to cook simple, healthy requires skill. You have to know why you're using fat. You have to know how to control the technique of cooking, and that's a really difficult thing. And there are a lot of people, and there's a gap, and Jennifer and I have talked about this. There's a breakdown in the system between the dietitian and what someone puts into an informed practice in their kitchen. And that's something that I set out to fix. So I saw the vacancy in that slot, and I said, you know what, this is a really critical thing, because my wife is just like everybody else. She cannot cook, right? That's why she married me, because it wasn't for looks, right? It's definitely for the cooking ability. So here are the challenges that we face in this system. So now we know that we've got a diet that's bad for us. We're understanding a little bit about why we eat, because we did some reflective thinking, right? Now we're looking at this, and we're saying, I want to change my behavior, okay? So some of this list is a personal list. Some of it is from study. But how do I do this? Because really, not many of us are pariahs. We don't want to make a pariah out of the cancer patient. We don't want someone to go sit in isolation and eat. We want them to enjoy a meal, right? So the reality is, no pills for this. You're not going to take a pill and be healthy and fit and skinny, all right? It just doesn't exist. So it's through a continuum and a journey and a process, and we have to just come to acceptance with that. You know, you can't make great food taste great without putting in the time and effort. We have a busy lifestyle. I don't know anybody, kids, sporting events, extra job, 2 jobs. It's hard, and it's a difficult existence nowadays. The fact is that change is brutal. Change is difficult for a lot of people. I don't like to change. It took me a long time to get rid of cereal. I didn't like that. I fought it, but I did it. The nutrition, I can tell you, when Bridget was first diagnosed, we had the mango incident. It's a well-documented incident in our house. Antioxidants, okay? And Jennifer, you can chime in anytime you want on this, because I love telling the story. So Bridget, she's like, oh, what? First of all, she had blame. She had that guilt of, I did this to myself, right? And as a caregiver, I had the guilt of, well, I stressed her out in our marriage. I did it to her. Anyway, mangoes galore. We're going to Sam's, we're buying cases of mango. Right? Now I can't stand the smell of a mango. Every moment, every day, she was eating mangoes. But it wasn't like, you know, she would eat them every hour, an hour. It was just like if you had a meal, there's 3 mangoes. If you had breakfast, there's a mango. Lunch, a mango. Right? It was the one thing that had lots of antioxidants in it. Well, antioxidants are time released, right? So you can't sit there and eat all these things at breakfast, not eat till dinner, and then have that effect. You know, it's kind of like you got to kind of replenish as you go. But anyway, we ended up eating like 50 cases of mangoes, and to this day, I can't smell or do anything with a mango. But it's confusing. We don't know what to do. Just had a conversation last cooking demo about certain types of antioxidants, and then soy. Soy is like the hot button, you know. And I get on these tweet chats all the time. So I work with treatment diaries, and I get on these tweet chats, and it's the number one question: is soy good for you, or is it bad? Yes. My answer, yes. Soy can be very good for you. Soy can be very bad for you. It depends, you know, and I think some of that's personal. You have to answer that for yourself. But it's a confusing world out there. The diet of cooking plant-based foods requires that you understand how to cook that. You go to the farmer's market, right? How do you grab the little baby fennel bulbs that are wonderfully delicious? What do you do with them? How do you cook them? You know, how do you make taquitos healthy for your kids? You know, how do you put that into practice? You know, and that's what we set out to fix that issue. But that's a real issue for a lot of people. They just don't know how to cook. Tuna casserole is canned tuna, canned cream of mushroom soup, you know, and egg noodles. All those are processed foods. All those have 10 times the sodium you need in a day. You know, so it's a big issue. We have an addiction to food, right? And then we have all these dining out options that are hard for us. You know, how do you make a healthy choice in a restaurant? That's a very difficult thing. And how do you know that the chef that was in the restaurant preparing your food actually took the time to control the product in the recipe? You know, I'm a big fan of food labeling. I'm a huge fan, even for the independent restaurant. I think it has to come. I think people have to make an informed decision. You know, at the same point, I sit there and tell you I don't think we need to do nutrient analysis and everything. We do them for our recipes because some people require them. But for the most people, it's about the technique. It's about knowing where your calories are. So again, where do we begin? This is my favorite. Roller coasters make me sick. Literally, they do. I can't get on a ride to save my life, okay? But I never once, ever in my entire life got on a roller coaster diet. I never wanted to do that. I always knew I had an unhealthy relationship with food, and I always knew that at some point, when the time was right for me, I was going to change that. So I never did the roller coaster. And it's the one thing I'll always tell people is fad diets, you're getting on a roller coaster ride. Because what do you do if you haven't fundamentally changed how you live and how you relate with your food? How do you have a sustainable change that is permanent? You know, and that's the issue that I think the fad diets and why I'm so against them. It just doesn't last. So what do? You go on a smoothie diet, right? You're going to eat smoothies all the time? Is that going to be the only thing you eat, are these smoothies? How do you exist like that? You know? And what do you do when you haven't modified your behaviors? How do you get a change that lasts forever? So we took a principle-centered approach. And I think it's really been fortuitous to do that. In terms of, I'm a big fan of Stephen Covey and the 7 Principles, so I do a lot of management instruction. I like the 7 Habits of Highly Effective People because they become ingrained, and I like principle-centered management practices. And then I took that same thing and I put it into practice here in the sense that if you have a food philosophy and if you embrace that philosophy, over time it becomes an unconscious part of your daily existence. And I think when you do that, when you have those moments where you break down and you go to Five Guys or you go and you have chicken wings or something, you can live with that infraction better than you can if you were on a diet and you broke the diet, because now you have guilt associated with breaking the diet. And guilt is an awful thing. Guilt manifests into anger. It does all sorts of weird things for us. By having a philosophy, you can recognize that you have a compass where you want to go nutritionally and with your relationship with food, and that guides you every step of the way, just like a vision statement would in a business, and we can, you know, get mission, vision statements, all that stuff. But these things matter. I live by this to date. This is one of my favorite things. And every time I touch food now, I am really focused on this. I eat real food. I try very hard not to eat food out of a box. Every once in a while, my son likes Kraft macaroni and cheese. I have to make it. He has Asperger's. That's a rationalization. So that being said, you know, there are times where I'll sit and I'll enjoy his food with him. I will take him to McDonald's once in a while, you know, and I'm not going to make him sit there and eat by himself, and I don't feel like a horrible parent because I took my kid to McDonald's, because I know that night he's going to have broccoli, you know, and he'll have something good for him, and I live with that. And by having a philosophy, it allows you to have a compass, and that compass keeps putting you back on the right track. It doesn't mean that you can't take a divergence. If you want to go out and you want to have a 4-course meal on a date or something like that, go for it. Enjoy it. I mean, really, really enjoy it, and like break all the rules, knowing that tomorrow or leading up to that meal, you did the right thing. You ate better. And that's the difference between a philosophy and a diet. And I think that's where you get really sustainable changes, and you have a very informed practice. So, Jennifer touched on some of these things. Why real food? Real food, from a psychological standpoint, from when your response to eating food, and you can go back to think about the last thing you ate. What was it that you enjoyed about the last thing you ate? Was it the salty flavor? Was it the texture? Did it subconsciously fill you up? Were you satisfied? Real food, when I say real food, I'm talking about whole foods, unprocessed or minimally processed, because in olive, you could never get an unprocessed olive because it's cured, right? I ate lots of olives. But anyway, it promotes a satiated feeling in your mind, and it triggers food differently. Boxed food, processed food, is empty, and it doesn't provide the same subconscious satisfaction that real food has, that lettuce has, that eating a salad is different than eating pasta. So I had the plated lunch today. I gave up, thankfully, the person next to me, because my wife was supposed to sit. I ordered her the pumpkin ravioli, because she likes pumpkin ravioli. I don't eat pasta anymore for the most part. So somebody switched with me, and I had this salad. And the salad was incredibly satisfying. The crunch of the carrots, the lettuce, the chewing. We respond to those things subconsciously. So when you think of the things that make up a really good meal, or a dish, or recipe, they hit all of your senses. And real food does that much better than processed food. Processed food is often soft, it's often salty, it's often sweet, but it doesn't provide a lot of texture. You know, if you think about that, it really doesn't. You know, food coming out of a box, it's a very difficult thing to have that full acumen of sensory engagement, if you would. Again, better fuel, better performance. I like to think of my sister-in-law as a pediatrician down in Albany, and I don't understand juicing diets, and Jen, you can jump in on this. For me, I don't get it, because we're always told to eat our fruit and not drink it, right? But there's all these juicing diets and all this stuff. For me, an apple, right, and I eat a lot of apples in my life. We had an apple orchard growing up. An apple puts the sugar where it should be. The fiber makes it travel through your system, right? And it puts the sugar where it should be, where your body should break it down. Not on the top breakdown. And I think that's the difference between whole foods and processed foods in terms of the glycemic factor. And again, I mean, feel free to chime in on that. And that's the thing that we don't really understand. And we don't have to get into a whole bunch of scientific data. Real food puts the food where it should be to break down. Our bodies were designed that way. And there, problem solved. You eat real food, it goes where it's supposed to go, and you have a lot less reaction to that, you know, your body's response to food. And then also, we have seasons. After Labor Day, I don't like a lot of tomatoes, and I put the picture of the tomato up here. The way I eat tomatoes after Labor Day, because I eat these tomato sandwiches all summer long. I love tomatoes, right? After Labor Day, I roast them. And that's the only way I can eat a tomato. I don't like raw tomatoes after Labor Day. I don't like Macintosh apples before September or after September. There's seasons to these things. And we are programmed, you know, when the weather gets better in the spring, we like lighter, greener foods. You know, it's that time of rejuvenation, and our bodies respond to that. Media is designed around that. They offer you color palettes that are more lighter green, blues, all those things. Your food often goes that way. Peas, arugula, baby greens, leeks, things like that, wintered over vegetables. It's all lighter. And then as the weather gets warmer, it gets a little bit darker, a little bit heavier foods. So food has a season, and after a while, your body will respond to that, and you won't want some of these things that are out of season. The reason I bring up seasonality is that seasonality also equals affordability in your food choices. When food is in season, especially local food, it's less expensive than out of season. If you look at cauliflower in February, why anybody would pay $4 for a head of cauliflower is beyond me, right? Cauliflower is $2 max when it's in season. Asparagus right now, It's like $5 a pound, right? In season, it's 99 cents a pound. Why would you eat it out of season? What's the point of that? You know, just to have asparagus, have green beans. You know, green beans are like an 8-month product. So anyway, you know, that seasonality helps your food choice. So this is one thing that I'm kind of big on is the food choice architecture. And that means where is the system that you engage your resourcing of food? Vermont, and I'll tell you, I live in Peru, New York. I've taught over here for a reason. You guys are in food heaven. You guys have access to more fresh, local food than Napa or Sonoma or any of the other top culinary destinations. Vermont is food utopia. There's so much good stuff happening on the food scene here. There's so many people that are committed to the landscape of food in Vermont that it should be celebrated. And I think it's a blessing in this small little state that exists. It is wonderful. And you guys have access to so much fresh, whole, natural food. You've got farmers markets. You've got local stores. Even the big box stores are bringing in some local farmer stuff, which is cool. They also have access to some organics, you know, and I think we have to also say, and I'm not a huge proponent of local. I don't get into the politic of that because there's all sorts of issues with that. You buy what you can afford because that's a real concern. Not everybody has $600 a week to spend on food. You know, that's not a reality for a lot of people. You have a budget. You have to stay in that budget. So you buy the best food that you can afford. And I'm very adamant about that. You know, you have to make those smart choices. But you've got a great food choice architecture in Vermont. Upstate New York is catching up, but we're about 10 years behind that. So in that, though, if you want to change your practice and how you go about making the right decisions that are on that food philosophy that are best for you, you have to have some required amounts here. So the first thing is you have to have a healthy pantry. So what is a healthy pantry? A healthy pantry is to know and to accept that you're going to break down and you're going to want something quick and easy. Period. It's going to happen. Okay? Know that in advance so you have something that satisfies that stressor. Me, Greek yogurt. 100% Greek yogurt, little maple syrup, and then some of our Vermont maple crunch that we do. That is the #1 snack food I have. That replaced cereal, thank goodness. It also has casein, which is a dairy protein that takes longer to break down and actually really satisfies you at night, and you don't actually wake up hungry. So that's my nighttime gig. Have some shopping strategies. I did a salad earlier today that was arugula. So how many people eat iceberg lettuce? How many people really like iceberg lettuce? I like iceberg lettuce. I like the wedge salad from 1952. I think it's awesome, right? Iceberg lettuce is a vessel for salad dressing, period. It has 0 nutrient value to you. It has fiber, it fills you up, that's great. Compared to romaine, it's 1/40th the nutritional value of romaine. So, a lot of people eat iceberg lettuce though, right? Anyone eat at a cafeteria lately? A salad, right? You get some field greens, but a lot of times it's iceberg lettuce. So have a shopping strategy. The looser the greens, the darker the greens, the better they are for you, period. That's a great shopping strategy. You know, if you're looking for something that's really going to impact you, dark leafy greens have a big effect. The cruciferous effect. I was actually listening to somebody yesterday, but it was talking about the cleansing effect that cruciferous vegetables have on you. I don't know if you want to expand on that at some point, but in the question answer. But you know, have some shopping strategies. Know what you buy. Know what that next level up in quality, nutritional quality for your cellular body is. Figure out what that is. The next is figure out what you're going to do when you dine out. You know, how are you going to handle that? Because you want to go out. You want to have that. I mean, going out to eat is fun. You know, for a lot of people it's fun. You want to have that strategy in place, and you want to know what you're doing with that. The second is you got to learn how to cook. So if you're going to cook real food, if you don't know what you're doing, right, how enjoyable is that meal going to be? I mean, you can, you know, fumble your way through that, but for the most part, if you just focus on the techniques and you learn how to do a couple things really, really well, your diet improves, your enjoyment of the food improves, and then that triggers, right, enjoyment and pleasure, and you want to go back and learn more techniques and cooler techniques, and then you want to be a whiz in the kitchen and chop, 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 and all that stuff, which is fun. Again, learning to cook, a couple things. You control absolutely everything about what goes in your food, except for where it's grown. So if you pay attention to great ingredient selection, you control your sodium, you control the fat, you control the quality of your calories, which is, for me, fundamental. Second, I'm going to tell you straight out, it doesn't take more time to cook healthy. Okay? Once you know how to cook, cooking healthy takes no more time. For me to get in my car, to go down and pick up a pizza and come home is a 25-minute adventure, because I don't get delivery. I'm in a I'm in farm country, right? So we don't get delayed. So I have to say 25 minutes. What can I make in 25 minutes? I can make a lot of food in 25 minutes. I just made a great Thai dish in 10 minutes, you know? You have to think about that. So you have to have the pantry that's ready to accommodate the convenient mode you're in. And then you have to know what are 5 key recipes that you can make on the fly that are enjoyable to you all the time. And the second is, you know, the cooking process is you have to learn to enjoy it. Thomas Keller from the French Laundry, famous chef in America. If you don't like picking parsley leaves and you don't like chopping garlic, you have no business being a cook, right? It's just you have to love the mundane, you know, enjoy the process. A friend of mine, one of the big fundraisers for American Cancer Society, was talking to her husband a couple weeks ago. And he goes, I love to cook. I open up a bottle of wine, I have a glass, I turn the music on, and I just start taking my time. It's like, I don't do that. I don't do that. So I started doing that. I started going home. I had a glass of wine, a little bottle of cider. I was like, wow, I really like this. I really like cooking. It's not just the technique of it. I really like this process. And I've learned to slow down in the kitchen the last couple of weeks from that one conversation. And I think that was a really significant piece for me because I'm so focused on my technique, I'm not really concerned about my environment because in a professional kitchen, there is no radio. For me, in my kitchens, there was no radio, there was no talking. It was just do your job, chop, chop, chop. But at home, you should enjoy it. Get some great music on, you know, comfortable mat, all that stuff. And then for me now, it's making it a family affair. Everybody should be involved because you want everybody to have success with it. And if you got little ones, put them to work. You know, they're great vegetable peelers. I'm not going to lie. You know, challenge them to a race, and they'll never win, but challenge them to a race on it. And it's good because now you're teaching them how to cook, and then they're going to have a skill that's going to last them forever, and they're going to be empowered to have a really healthy diet as they move forward. So transformation strategies, and again, I'm very big into strategy and how you migrate to a new you. So understanding calories in, calories out if you want weight loss, or if you want to maintain body weight. And all of our talk is about BMI, because who knows how to calculate the BMI? That was a real confusing formula. We had one person raise their hand. But it's a complicated factor for the average person, right? And is that really the best thing? Calories in, calories out, maintain your body weight, right? Because a lot of people are saying lean, be lean, right? Because fat is that living tissue. I personally use Livestrong, Track What You Eat, MyPlate. I use that calculator all the time for me. And when I feel that, because as you're losing weight, when you feel like you're not losing weight, it's the best place to go back and start journaling because it informs your practice about where you're off track. And I absolutely swear by the fact if you're trying to start off, get an app. They're cheap. They're free even. You know, I think MyPlate was free. And I'm not a spokesperson for that, but it really worked for me. And it informed me of where my calories were coming from. I tracked myself for a couple weeks, and I started making changes. And again, some people are lean, and I'm jealous of that, and you know, I applaud you. I never had a lean body makeup. You know, I always was into sports and lifting, and just it was my gig. But anyway, tracking what you eat. The other thing is adding more plants. Plants provide balance. They provide sensory balance too, and that's the number one reason for me of including those in a strategy. Okay, not just the nutritional benefits, but from the sensory advantage. Plants provide a variety of texture for your food. And you may not recognize that up front, but you will over time subconsciously be trained to understand that. The more you eat of those, the more that you actually crave them. You want the crunch of those things. Again, knowing that you're going to be off track sometimes, what's your plan? How do you handle that? How do you handle that without guilt? Don't demonize food. You know, it's the relationship with food. You know, it's not food's out to kill you. It's not. You have a relationship with food. You know, how do you come back to ground zero and zero yourself in and move forward again? And it's okay to celebrate those little moments where you have a life celebration. You want something exorbitant. Have it. Just know how you're going to get back. And then understanding truly that it's a continuum, that it's a journey. And even if you are lean and you're trying to be healthy, your body is going to change over time. You know, and if you've had cancer treatment, your body responds to calories differently. I sympathize with my wife because, you know, I can control my metabolism a lot better than she can. You know, there's a difference in that. And if you look at, I don't know how many people had that plate of lunch, but they did that 30-day bed rest thing. That was frightening. And where your fitness, if you will, cardiac fitness drops dramatically the more sedentary you are. And obviously we know that, but it's just frightening, just that component. I mean, I'm in a much better position to control my outcome than my wife is because she had cancer and she had a treatment. It's not saying that she can't do it, but it is more challenging for her. She has been postmenopausal since 32 now. So there's a difference in how you respond to calories postmenopausal. And as Jen put out in the slide, I forget what it was, but the body fat becomes the #1 source of estrogen, correct? Is that what you said? And so I'm also, and now I'm realizing that this is a PowerPoint slide and not my Mac, so I have a little formatting issue. Edward Deming is a management theorist, and his constant continuum was plan, do, study, act. Put in a plan, put it into action, study it, analyze it, act on that analysis, come up with a new plan for the next day. I do this every single day, every single meal period. This is how I live my life now. I don't overthink it, but I recognize what's happening and I pay attention to it. And I think that's something that a lot of people, when they're making these changes to a healthier you, that's a very big part of that. And then I had a paradigm shift. So there's my wife and my son. I recognize that in my house, I cook for my family. I cook for the ones that I love. And if I'm making box food and I'm making food that's unhealthy, I'm not benefiting them, right? In a conversation with my son's doctor one day, we were talking just about medical practicing. He said, you know, I live by the rule of do no harm. And those 3 words really, really stuck with me in a very impacting way. And I never once, and I shared this at the last discussion I just had, I never once thought my job as a chef was to take care of people. My job was to make them happy and serve them. And I have a total paradigm shift about that now. And I believe that your food should do no harm. And if I'm putting excess calories and fat in your food, I'm harming you. And that's a totally different mindset. The other thing is, you know, as I sat here a year ago and I just started thinking, every other part of my life I was responsible. I was overly responsible. I'm fiscally conservative with my own money. I put away my money. I do all those things. I make sure the firewood's done. I make sure my driveway's plowed. I do all those things, but I was fat and it bothered me and it killed me. And I came up with just, it was irresponsible for me to be that way. And I made that shift based on that. And that's my own personal expression. And it was the responsible thing to do for me because I'm a caregiver, I'm a father, and I'm a husband. You know, I mean, technically I'm no longer a son, but it's, you know, I don't have that responsibility. But those things matter. And my wife, she needs me. My son needs me, flat out. And if I'm not taking care of myself to be there, then I'm irresponsible. And that was my paradigm shift with that. And then my phrase that I love is, you know, fight cancer deliciously. There's a lot of studies out there, and I just brought 2 with me. And now that I'm well over 40, eyesight goes. Dr. Soden actually gave me these last year when we were talking. It's the effect of obesity on prognosis after early stage breast cancer. And some of these things just really, really flat out, and it's the first time I've ever really heard her say, but obesity remained an independent prognostic factor for disease-free survival as well as for overall survival. And some of these are just, you know, highlighted catchphrases, but I wanted to bring these today and have someone look at them if they wanted to afterwards. There's some alarming things, and they're highlighted. And it really kind of put in that caregiver mode for me, the reality of a healthy diet and living with breast cancer. And again, I sat here and I listened to Jean Harvey Barino, and I sat here and listened to all the breast cancer survivors talk about the struggles and the challenges that they had. And it really bothered me that there wasn't a better solution, you know. And so what we did was try to figure out how do we provide that solution? How do we help people live a better life with something that's now treated like a chronic disease for a lot of women? My wife, she's going to live for a long time. I'm confident of that. And in that, though, it's no different than diabetes. It's a constant surveillance of yourself and of your body, and that's something that has to be addressed. And, you know, and you have to learn to live, because you know, cancer, the funny thing about it is it just takes away your control for a long time, and you have to fight really hard to get that back. You know, and that's the beauty of your diet, is you can control that. You can control your exercise. You can control how much alcohol you consume, and it puts you in charge somewhat of your destiny. And you know, and I think that's a really important thing. You know, because I don't like how breast cancer took control away from me. That really bothered me as a person. So. Now it's open field questions, answers, you name it. I'm an open book. I think Jen's an open book. I'll answer anything. So.
go if you don't live up here to learn how to cook?
So there's lots of things. So I'm a technology person. I like technology. I like YouTube. So I'm going to openly say there's a lot of access to YouTube. The problem with YouTube is you have to filter through the content. And so for me, we set out content to provide that, and I don't want to plug Pink Ribbon Cooking, but that's what we do. We provide that content in an online forum. We teach people how to cook. We use video. We use the online, the engagement strategies and education of how somebody with a different learning style might take in information. So, I mean, on the side, I consult for Prentice Hall, publisher, and I do online education consulting. So I'm a technology, an instructional technology expert. That's how I make my money for the most part. So in that, there are many ways to use text, video, PowerPoint slides, ebooks that can help people access information a lot better. But there's a lot of sources. There's cookbooks. I mean, I'm a product of media. I lived in upstate New York for many, many decades, and I mean, that's not New York City. So if you want to cook on a high level, you've got to take in information and you've got to put it into practice. So there's lots of ways. You can get a cookbook, you can go to our company, you can go to YouTube, you can go to Vimeo. There's all sorts of resources out there. No questions? Easy.
And I'll add too, just to go off what you said about change is hard. Change is definitely not easy. And so when I always do counseling too, one thing I have people think about is something really personal. You really have to make it personal. Why are you making change? Why are you putting more effort into something? So for one woman, it was that she always wanted to ride a horse and she couldn't, and her weight was affecting that dream that she always wanted to do, horseback riding. So really for some, it's the kids, family. So really thinking about that and really making it extremely personal. It has to be, and that's huge. And writing it down, I tell them, put it on an index card, put it on your bathroom mirror, and look at that every day, because that's really the most important part in all this is that cognitive restructuring, those behavioral changes, but it has to have meaning behind it.
I noticed something. I mean, I have a small sailboat. I wanted to get a really small boat. I bought a very old sailboat. Has no electronic device on it. It's 22 feet. So if you picture me on a 22-foot boat, it's kind of funny, right? Last year, I was sailing on it. And when you get on the boat, it does one of these big major things. I got on it this year. It wasn't that big. I actually noticed that. And I was so proud and happy of that moment in my life. And I was like, that's great. And for me, one of the issues was I wanted to go to a regular store and buy clothes. And that was a big thing for me. Like I really wanted that satisfaction out of that. And I'm actually able to do that now. And I feel great about that. And I think a lot of people, it's those little elements of success that lead to that change that takes root, because that feels awesome. And I will sit here and say, I have had the best food in this world. I mean, I have eaten at 3-star Michelin restaurants in France endlessly. I've been all over the world cooking and eating. Nothing tastes better than fit feels. Nothing. Nothing can ever be the way fit feels if you've been unfit. If you've been fit, I am so freaking jealous of you. I am in awe of you. Kim Dittis is a friend of mine now, and I'm just in awe of that lady in terms of, because one of her disclosures from a statement, from a presentation, she says, I consider these things easy. Exercise is easy. Running, stick a needle in my eye and kill me. No way I want to do that. Go cut firewood, I'm all over it. Go move a pile of rocks, I'm all over it. Running, I don't get it. But I am envious of people who are physically fit. And not that I'm not, the definition of fit I think has to be determined, but we all have that in our head. And we all have the image, and this relates to breast cancer, you all have the image that you want. And I think for a lot of women, an increase in body size is such a scar as a result of treatment, from the pre-treatment you, from the pre-cancer you. And I watch my wife every day, and my heart goes out to her because she's got a lumpectomy, she's going to have a double mastectomy next year, she's going to go through all these things. And I hate that about breast cancer. I absolutely hate that. It drives me nuts. And if I could fight it, I would, but it kills me. And so when you get fit, when you change that part of survivorship for you, it empowers you. And it puts you in control, and it basically says, cancer, you can't beat me. You know, and that's a real strong thing. And as a caregiver and as a husband, I just sit there and watch it, and it drives me nuts. And so by making sure she has nutritious meals, I help that along the way.